As Uganda is set to join the rest of the world in commemorating World Prematurity Day 2024 that will be commemorated on 17th November this year in Luweero District, Health Ministry has warned expectant mothers to always observe key issues that prevent premature birth, such as fighting malaria, embracing antenatal services, and good spacing of their children.
In Uganda, the commonest risk factors associated with preterm deliveries is malaria. So we really need to be able to look at how do we prevent what? Malaria in pregnancy. The others are infections, urinary tract infections in pregnancy, hypertension in pregnancy, uncontrolled pre-existing high blood pressure, diabetes, multiple pregnancies, incompetent cervix, drug abuse, maternal age, and this mainly affects the young and the old mothers, and poor nutrition among others.
Director Clinical Services under Ministry of Health, Dr Charles Olaro, says that premature death is the major cause of high mortality rate.
The burden of premature globally is high, with at least 1 in 10 babies born preterm, and prematurity is the leading cause of death among children under 5. So what Akulo is showing you here that unless you are addressed prematurity deaths, you will not be able to change the newborn mortality. So for you to be able to move from 27, 22 and move into 12 as the SDG aspires, you need to be able to dent or to reduce premature death.
Dr. Anne Akuro, President Uganda Pediatric Association, revealed some of the causes of premature birth in Uganda that expectant mothers should avoid.
We want to say, even if they are born, we want to prevent the births, but the premature births. But if they are born, we want to make sure that the children thrive, and there are things that can be done. Okay, my colleague talked about some of the reasons why children are born premature. There are problems in the mother and also problems in the baby. So things like in the mother, like sicknesses, malaria, can cause a mother to give birth early or some miscarriage. Okay, then hypertension, diabetes. Okay, then the other thing is nutrition. If a mother is malnourished, they might end up giving birth to preterm. Okay, stress. Okay, mothers who are stressed, abused, someone gets an accident, they get trauma on their tummy, or they fight. Okay, those are some of the things that can cause a mother to give birth preterm. Then there are also, these days, mothers are smoking, drinking. Okay, substance abuse and substance use can cause a mother to give birth preterm. But when we go to the baby side, things like my colleague mentioned, multiple pregnancies, many children, twins, triplets, quadruplets, okay? The space in the mother's tummy gets smaller, and these children are born premature. And then there's some children who just have conditions, like you've seen children who are born either the back is open or something, like newborn, what we call congenital conditions.
Other experts shed more light on how to address the problem of premature birth in Uganda.
Sometimes some babies are formed with some malformations, congenital anomalies. Those ones also sometimes come out early. But there's also something we need to address as a community, like gender-based violence. We've seen mothers going through trauma.
What we need most of all actually is neonatal nurses. So we need the right space, we need neonatal nurses, and we need basic equipment. So being able to do kangaroo mother care where the baby's tied to the front, then that helps them. They don't get too cold, they don't get infections. Also basic breathing support.
West Nile has been cited out as the region with high rate of premature birth, with Karamoja being the region with lower number of premature births. World Prematurity Day 2024 in Uganda will be commemorated at Luweero Hospital in Luweero District. Julius Muhumuza, Church of Uganda Family TV, News at 8.